So here we are with Connie from YWCA Banff. I am very grateful that you're taking some time of your busy day right now. I know you are at the front lines working with all the community, trying to bring everybody together. So I really wanted to send my appreciation to you and to all of our YWCA staff doing heroic work at this difficult time. And before we start, I just wanted to say that YWCA Banff has stepped up in very incredible ways during this crisis, and we want to hear more about that. Connie, what does it look back in Banff? How does it look on a normal day in Banff at the YWCA?
Gosh, well, on a normal day for us, especially at this time of year, we would have many programs running in the community. We would be working in the schools. We would have residents coming and going. Our shelter would be and has been very busy this year. So there would be lots of activity around our building. And our social enterprise hotel would be very busy because it's March break. And so we would have people coming in and staying at our hotel, which would help to support our programs. And this would be, one of the busiest times of year for us in terms of generating revenue through our social enterprise. So today, what it looks like is very quiet in our hallways. We still have about 100 residents living in the building. And we have a very small number of staff working in the building, and then a number of staff working from home. And to be quite honest, it feels a little bit like the calm before the storm. And we've just been preparing, we've been putting protocols in place, we've been developing and working with partners around food programs, we've been reviewing our protocols every single day, we've been trying to get PPE and equipment to help support people to be successful in isolation. And we've just been trying to support members of our community and our own team. This is unique, and as everyone knows, typically many of our staff would be on the other side of the table just providing support, and now we all need it. And so we're just looking at new ways to do that for each other, and recognizing that everyone experiences stress in a different way, and as a team we're just learning that about each other. So
yeah. Thank you so much for that. I think something that has been really resonating with us from the news from Banff is that as a rural community, the realities are very different when we think about a YWCA in a big city or in a big space. So I really, maybe it would be very interesting for people to understand what can you share with us about being a rural community, also that depending on a very much tourist economy. When you say that it's so quiet, what's happening to the people that work there? And I think from the work you've been doing with the change in the service provision for the social enterprise, so it's a hotel that the YWCA runs normally, but what's happening to that? What have you been doing?
Well, it's been interesting to look at our town, because most people across Canada have been to Banff and have some sense of it being a thriving, bustling place. And I can tell you right now, there are more elk on the main street than there are people. And there's been a number of pictures of sort of animals crossing the main street because there are just no one here. And we had to invest quite a bit of media to actually ask people to stay home, because people want to go out for a drive and they want to have some fresh air. And so people were coming to Banff. And we're not a very big town. We actually only have about 8,500 residents. And I can tell you in the last couple of weeks, 85% of our workforce is laid off. And many of those people would have been frontline in the service industry, working in the ski business. And most of them would have lived in employee accommodation. So not only did they lose their job, but they have the potential to lose their housing. Now, many of our employers have stepped up and have made spaces available, whether it's in hotels or in their accommodation to let staff stay there. And many hotels are feeding their staff 3 days a week. But I'm not sure how long that can go on. And there is just a high level of sadness, a high level of frustration. Many of our residents, didn't grow up in Banff, so they don't have their family nearby. Many people are living in shared spaces, maybe slightly overcrowded spaces, lots of shared kitchens, shared washrooms. So it's not necessarily great in terms of being able to isolate and practice safe distancing all the time. So so it's been very challenging, and we know money is coming to people, but it hasn't all arrived yet. And so our food security programs are just bursting in terms of need. Again, so many of our hotels and restaurants have stepped up and are participating in sort of emergency food response. But it is a very, very different town. And, we have a lot of people who are very physically active here and who are used to being outside all the time. So it's very, very challenging for people. Yeah. And we're all learning to adjust, just like everyone else across the country.
Yeah. I think the other piece that I wanted to mention, and you kind of touched on that, is, how people have stepped up to the circumstances. And I think is something I really want to know is what has touched you and what has excited you in terms of response?
Well, it's been actually really amazing for us because I always say, like, no matter what people are calling about, there's a way that they can help. And sometimes it's like people are reading our minds. What we found is many of our residents will come and they don't have a cell phone or they don't have a tablet. And people living in our accommodation, normally they can just come down to the front desk and talk to our staff and pay their rent and do those things. Or if people are in shelter or if they're in one of our other supportive housing programs. And so now what we're seeing is that need that we have to provide either some sort of communication so that we can stay in touch with people. And so, we're thinking about this, and at the same time, someone's calling saying, hey, I've got a couple of phones for you. Or, hey, we've got some tablets that we're not using. Can we drop them off for you? Or a company like Rocky Mountain Soap, which is a national company, saying, hey, we're making some sanitizer. We've flipped our chem lab and we're making sanitizer. How can we drop some off from you and for you? And a couple of our distilleries. And people, bringing clothes, because now we can't go and buy clothes and, for people in our shelter. And so there's just so many little things. Do you need some books so that some of our rooms don't have televisions, so we can share some books with, so that you can have them for people. And, it's been really amazing. And I have to say too, that there's been a couple of key organizations, some of our bigger hotels and our local foundation and our town of Banff, our municipality has just been incredible in terms of helping us to get what we need, whether it's gloves or other PPE, and really just really being there for us, giving us lots of good information. Our health inspector, they've all just been right there supporting us, going through our protocols with us. So I feel very, very supported in so many ways in our community.
That's so good to hear. I'm excited. I know that in hardest times we can rely on each other in our communities, and that's fantastic. I think something that we are also bracing, and we've been talking a lot in the national office, is about, we work on issues of gender-based violence. We work, our mandate is to build an equitable Canada. We want to see that now. We want to see it in our lifetime. What would this mean for all this work? And we are trying to keep our spirits up. We've gained so much momentum in the past decades. And how can we continue with that momentum as we look in the future, even with COVID? You also mentioned at the beginning of this interview, where we feel like it's very quiet, like we're bracing for the biggest storm that we're going to be facing. What is that? What is that? How does it feel? What are the conversations you're having? What do you think might happen? And what do you think we might need to brace for in the coming months?
One of the key changes that we made to our organization, I think, has been really to focus on what our core business is. And responding to gender-based violence would be a critical part of that. And that flows through not only our programming and our services, but also in the spectrum of housing that we support. And as a result, we made the very difficult decision to take our social enterprise hotel, which is 43 hotel rooms and 30 dormitory style spaces, and to wind down the hotel and to transform those spaces into housing units. And that would allow us to create more spaces for isolation for our existing residents and anyone who's coming into our building now. So if someone comes in and requires shelter, or if they require support through our program for people experiencing homelessness, or if they're coming in for our residents, we're requiring everyone to go into isolation for 2 weeks. And so we now have been able to flip hotel rooms. We've put crock pots and fridges and toasters so that people can be more successful to isolate. But we've also created some isolation spaces for our community as well, because we know there's no other facility in town that's dedicated for that. So we're working very closely with our emergency center to help vet, that they're helping us to vet people that need isolation spaces, and especially with a focus on more vulnerable people. In terms of our programs and services that really focus on supporting people in response to gender-based violence, we have continued to do shelter, and we are continuing to do support for transitional housing, and we have just learned how to do it online. We do have some staff in the office, and sometimes in terms of still doing some face-to-face work, but at safe distances around intakes, but because we know how important that is right now. And we are seeing, you know, regular calls still coming in for us, and our shelter is small but mighty, and at this point, you know, we're full. So we're also looking at sort of backup plans around how we can continue to support anyone who needs emergency shelter right now. And then in terms of for outreach counseling, we have quite a big outreach program. So really encouraging people in the community and women in the community who need support through outreach, and maybe women who in the past might not have thought of calling us, but just calling because they have questions, or they just want to get some information, or they want to make a connection and just reach out and talk. So we're really, really promoting that, and kind of done a whole big shift to push that online. And a lot of people sort of, I think, we're just sort of entering that big phase where we're seeing the challenges around mental health. We're seeing the challenges around people being at home, people working at home together. And so just trying to help with some strategies, you know, around relationships and keeping healthy relationships. So, you know, we see that as super high priority for us. And so we're absolutely maintaining all of those services throughout this process. And, you know, we've been lucky to be able to receive some funding from the province of Alberta to be able to continue to do that work. So.
That's such great news. I think that's a very important and essential service. So what, I think we cannot finish this conversation without telling the people that might be listening, what is that YWCA Banff needs now? What do you think our sisters YWCAs need across the country right now from all of us?
Mm-hmm. Well, the YWCA has been around for a long time, 150 years, and in Banff over 100 years. And our focus in Banff has always been around supportive housing. That's always been a core of the work we do. And since the late 80s, you know, very much around supporting people's experience of gender-based violence and helping to address that. So when I look at what we're focusing on now, for sure we have a big focus on the day-to-day, but there are some funding pots coming up, and we're super grateful for those. And we've gone back to donors and asked if they would redirect where some of their donations have gone. We've gone back to foundations and sort of said, this is really what our priority is right now. And everyone has been really responsive. My concern is really looking beyond 6 months from now and what's going to happen, because we know all the research shows and tells us that after after a pandemic, after a hurricane, after a forest fire, you know, after all of those big emergencies, this is the time, the 6 months, the 12 months, 18 months, where we expect a major influx of need in terms of mental health and also people's experience of violence. And so we need to be prepared for that. And so being able to keep our lights on, being able to pay our bills, being able to pay our staff so that we can continue beyond this 3 to 6 month period that we're in right now. And I mean, it's great, and we're super, super grateful for all of the money coming in right now. But often the caveat around them is it's sort of 3 to 6 months. And so my big concern really is looking long term, because our hotel right now is full of people that are in housing and paying, you know, fairly low rents or no rents to be there. And our social enterprise generates about 65% of our revenue. And on March 4th, we had our largest fundraiser scheduled, and we had to cancel that. So that our ability to be able to continue in offering services and to be able to continue to sort of generate some revenue and to be able to get our business back up and running, that's my concern. And so if I were to ask donors, I would say, you know, please think about that longer term, because that's part of our focus right now. And if they could support us in primarily, you know, through funding so that we can continue to operate for the long term, I think that's the most important message I would say right now, given the support we're getting from some other organizations.
Thank you so much, Connie. I really appreciate you. Thank you for telling us how things are going on in Banff. And I will be sharing this far and wide. And we continue to stand in solidarity with you. We continue to hear the news of your work and the needs of the people of Banff and all our communities across Canada. And thank you again for making time for us.
I'm happy to do so, and just wishing everyone all the best and to stay healthy.